that take place at Teeters, but primarily 3B, national caregivers, grandparents raising grandchildren, home care. We may do some transportation. I think we fund some of the meals, the Meals on Wheels program. So KIPTA is the pass-through agency for all of the older Americans Act programs in this region. We also do quite a lot with Trager, another good partner. So we're just really excited about the turnout. And please reach out to Amanda and any of our caregivers. I know that's not the focus of the event today, but please get her contact information. Thank you.
So one thing I mentioned, so Beth mentioned that Amanda was a speaker at the last community chat that we had involving older adults. It was actually for support for caregivers of older adults. And so in December of 23, and we learned a valuable lesson for those of you who are wondering why we're doing this in the middle of the day. That you know, you'll notice as I came in the back of the room, and I talk about this later, that we videotaped this and we posted it on our YouTube account. And when we had our talk in December of 23, it was a lovely evening. It was a great talk, actually. A lot of important, great questions came up. But it's the only talk that we've given so far where there were more people who watched it on YouTube than who attended. And actually, probably less than half the people who RSVP'd actually attended. And when we circled back and we called people, we realized something that as a provider of services we should have known already, which is that 5:30 to 7 on a Tuesday night is not when caregivers feel supported by leaving their loved one at home and coming to a talk. So for those of you who are unable to come to that December talk, it is still online, and I apologize to you for having had that evening and we didn't realize that, and this is why we have this during the day today. So thank you for joining us for lunch. As I mentioned, I'm the CEO of JFCS, Jewish Family and Career Services. It's a broad social service agency. We serve about 2,300 people a year throughout the Louisville community. And it's a program that serves people regardless of age, religion, ethnicity, immigration status, country of origin, any of those factors. And we serve with Jewish values in mind. For those of you who are new to our community chats, I welcome you today. We started our quarterly community chats in 2023. And it's to highlight the critical services that JFCS provides to our community, but it's also to highlight the importance of building a stronger community by collaborating with others, whether it's other nonprofits, as we come to see today, or other members of our community. We also have many corporate entities that we partner with as well. So getting back to sort of talking about today in particular, according to the AARP, 15% of Louisville's residents are 60 and older. Tomorrow will be one more, actually, as I turn 60. The area's older population is expected to increase by as much as 40% by 2050. The needs of our older adult population and their caregivers continue to grow significantly. I don't know about many of you, but none of our adult children live at home or live in Louisville, right? What's going to happen is we, and that's a continuing issue with our community. And we have to ensure that we are prepared to support the individuals of our community and their families as best way possible. We need to create innovative programming that listens to clients and that is critical. And in that way, it's critical to listening to their needs again. I'm reminded that we're having this today at lunch. JFCS has been a part of our community, serving the older adults in our community for over 30 years, and we consider ourselves a vital community resource. Again, not just to Jewish elders, but elders throughout the community. Through long-term care planning, transportation services, career supports, crime prevention, and victim support, home care services, some of these that Whitney will discuss, at least from the JFCS perspective. We provide seniors with services they need to age in place and to age with dignity. Many of these programs would not exist without the wonderful support and the innovative funding by KIPTA, which I can never get your acronym without reading it, Kentuckiana Regional Planning and Development Agency. And of course, for JFCS, we have a wonderful grant from the Humana Foundation. Thank you very much to the Humana Foundation, the Legacy Foundation of Kentuckiana, and the Klein Family Foundation, as well as individual supporters. As we prepare to get into our chat, there's two more pieces of information I need to share with you. One is that at your tables is a flyer. On that flyer is a QR code. We invite you to use that QR code if you have questions for our panelists. What will happen during the course of this chat is that the coordinators in the back will receive those questions and she can then text them up to me. If you don't want to text it, if you want to be somebody that asks the question yourself, we welcome that towards the end of the talk as well. But the QR code is an opportunity for you to share that question without getting into it. And as always, as I mentioned, this is being videotaped. It's primarily being videotaped to see the individuals that are speaking, but we will have to back with some of your heads. So again, if you do not want to be on videotape to ask me questions, feel free to use the QR code. So before we dive into some of the questions, and these are questions that were prepared by our panelists, and by many of you submitted questions during the registration period, let me introduce today's panelists. So starting all the way at the far end of my right is Justin Magnuson. Justin is the Senior Program Manager at the U of L Trager Institute for Optimal Aging. He has coordinated the Kentucky Most Coalition since 2017 and managed interprofessional education programs at the University of Louisville Trager Institute since 2018. The experience of being his grandmother's healthcare surrogate and a longtime hospice volunteer is what has inspired his passion for contributing to creating a healthcare literate public and a patient-centered healthcare provider system. When he is not in his office, he can be found outside gardening or looking for birds. Justin, thank you for joining us. Next to Justin is Sarah Teeters. Sarah Teeters began her career with Louisville Metro Government coordinating the Office for Aging and Disabled Citizens in February of 2016. In her role, Sarah focused on providing leadership to and participating in community activities, advocating for rights, policies, and funding that enhance the lives and independence of older adults and individuals with disabilities. In December 2020, Sarah became the Advocacy and Outreach Division Manager and was appointed as the city's ADA Coordinator in 2023. Continuing the great work upheld by RCS, which is now actually OSS, and working more directly, AmeriCorps Seniors Program is something she considers a privilege that she gets to do each day. Sarah graduated from Indiana State University School of Health and Human Performance. She took special interest in aging studies when she became a family caregiver for her grandfather, who was diagnosed with Alzheimer's disease while she was attending college. Her entire career has been dedicated to serving older adults and persons with both cognitive and physical disabilities to improve their quality of life. Thank you for joining us, Sarah. Next to Sarah is Dara Cohen. Dara has been the Active Adults and Senior Programming Director at the Trager Family Jewish Community Center since April 2021. She began her work in the Jewish community by volunteering here and fundraising for the Sonny and Janet Meyer Food Pantry, which is also a Dare to Care food pantry at JFCS. Dara holds a BA in Communications from the University of Wisconsin-Stevens Point and a culinary degree from the California Culinary Institute. Thank you for joining us today. And last but not least is Whitney Boswell. Whitney joined JFCS in February 2024 as the Klein Older Adult Programs Coordinator. This year, Whitney was promoted to the KOA Program Manager, where she helped supervise the KOA team and older adult initiatives. She works in underserved senior housing, courtesy of a Humana Foundation grant, focusing on increasing socialization and activity opportunities. Originally from Owensboro, Kentucky, she lived in Portland, Oregon before moving to Louisville in 2006, and most recently was an academic advisor with Academic Partnerships. She graduated with a bachelor's degree from the University of Evansville and earned her master's in literature from the University of St. Andrews. In her spare time, Whitney enjoys going to concerts, knitting, cooking, and playing with her son and their dog, Greg. Thank you for joining us. All right. The way we often like to start these conversations is sort of with what I call a level setting section, where we talk about certain issues that help us make sure that we're all on the same sort of same point about specific issues. So what we're doing today is there's not a particular question for particular panelists. Panelists will sort of chime in when they want to, and if somebody gets to chime in, I get to break them and get them to talk. So it's fun for me in that way as well. So we'll start off with a question about population trends. And I'm gonna cheat. I'm gonna ask Sarah to start off with this one, but because I think it's unique to your position, actually. To talk to us a little bit about the population trends in older adults, for older adults, and nationally how Louisville mirrors this or does not mirror this.
So, I don't know how close I need to get this. Am I good? Okay. Nationally, much as you said earlier, trends are increasing, right? We know that. We know that baby boomers are all now older. Our population overall is increasing, and Louisville is very much seeing the same thing. Louisville metro population right now is estimated about 622,000. Jefferson County overall is 772,000. When you really focus on a lot of our programming, and we pull a lot of numbers for federal funding and programming and those numbers. So we look at 60 years of age and older for most things. There are a few outlying programs that are different, but we'll just go with 60 for this discussion today. 60 years of age and over, we have 189,313 people here in Jefferson County. With that, as we know, there are more females than males, a pretty significant number, about 20,000, and that nationwide. Us women, we tend to live a little bit longer, so we really have to, kind of pay attention to that in terms of our numbers. 42,000 report having a disability of that 60 and over, so we have about 40,000 people who report having a disability. That was in 2023, the last statistics for that one. And about 3,000 households over the age of 60 are responsible for raising a grandchild under the age of 18. So when we look at caregiving and we look at programming, these things are going to be really important as we go on. Louisville itself has one of the oldest median ages in our nation. So our median age currently is 37.7 years, 36.6 years for males, 38.9 years for females. And in the 9 neighborhoods west of Louisville, the life expectancy is approximately 67 years of age. In contrast, 82 years of age for the eastern half of our county. So pretty staggering when we look at that disparity there. That is not a nationwide trend, that is a Louisville trend, Jefferson County trend. But something we really do have to pay attention to when we talk about some of the health disparities and things like that. Average household income in Jefferson County is $91,264 with a 16.13% poverty rate. One of the interesting things, even though our nation population is increasing and a lot of our, we are not considered one of the biggest cities as we look at that overall, but really one of those kind of middle growing cities. But the last few years, the population in Louisville has actually declined by about 0.48% over the last couple of years. And a lot of that is twofold. It is younger families raising children and older adults who require long-term care placement and different types of benefits. So those are things that, when we look at how we're making referrals, how we're talking to people who are trying to get into place, those are things that are really coming to light. So a lot of numbers, and I have to write those down, so excuse me for reading them, but I can't memorize all those numbers. But yeah, so the trends, when we start to look at some of that, some of them are a little more alarming than others, as you can tell by the gasps occasionally.
Thank you for that. Anybody else have?
I do have a little bit of data from, everyone can hear me okay? A little bit of data. All right, thank you. So I do have a little bit of additional data from the work that I've done in West Louisville. So the main point of the Humana grant is to combat isolation and loneliness. And so we do that with measurements called UCLA loneliness scale, and the Lovin Social Isolation Network. Basically, we want to know if people are feeling lonely and isolated and how many people they have in their lives. And so from my surveys that I did, now this isn't a very large number, so please be aware that this is a small sample size, but the clients that scored in the socially isolated range is 39%. Those that indicated a moderate degree of loneliness was 42%, and the clients that indicated a moderately high degree of loneliness was 45%. So we're looking at an average score in the UCLA loneliness scale of 46.8, and scores range between 20 and 80, with a higher score indicating a higher level of loneliness. And so this is what we're seeing in our, in our West End. This largely comes from the sites that I work with: Community Towers in Russell, Neighborhood House in Portland, the Puritan and Hillbrand House in Louisville. So that's what we're seeing as we go west, but the trend of isolation and loneliness is not just confined to West Louisville.
Sorry, are you saying that you live in those facilities?
Yes. I go there and I bring activities and classes, and part of them is participating in my activities and classes is filling out these surveys.
So they're in a facility with other people, but they feel that way?
Yes.
Okay, I just want to make sure.
Right, so,
Yeah.
right, and I'll point out that there's some great research on the difference between loneliness and isolation, and that individuals who are not alone can certainly feel isolated. And there's some interesting research actually that ties into the older culture of adolescence, right? And if you think about adolescents, you don't know a single adolescent that isn't surrounded by 25 other adolescents, and yet they have a high degree of isolation.
It seems like they're all together there, so we should be able to fix the problem,
Right,
somehow.
so it's more than just being around.
Yes.
So that's something I think we'll be talking about probably as we keep going. Just recently, but you were going to say something.
No, I'm just kind of, and I didn't think about getting specific data around this, but so Sarah's statistics about aging adults in Louisville, a lot of the core of what we do at the Trager Institute is around, the fancy term is geriatric workforce enhancement. So we're trying to train healthcare professionals that care for older adults. And the core of our funding initially was around training the geriatric workforce because as the population is getting bigger, the geriatric workforce is not getting bigger. And so really looking at the amount of healthcare professionals that we can care for older adults and specialized knowledge is not keeping up with the rate of growth. So that's kind of a core thing what we're doing in our programming is to kind of try and meet this deficit between the growing population and professionals.
Okay. So I want to, so as often happens, I've lost control already. So we're moving to kind of what they do, but that's okay. So to pull back one more time to sort of level setting things. Sarah, you mentioned long-term care. And I have on here a note about long-term care planning. So again, my understanding is that there's a difference between long-term care placement and long-term care planning per se. So does anybody want to chime in and talk about what long-term care planning is and how that may or may not differentiate from long-term care placement?
I mean, I think just for the common good, so when we were talking about long-term care planning today, we're talking about the aging in place. So how do we plan for it? And it could be eventually looking at facilities that, what do we need to stay purposeful, healthy, all of those things later into life. A lot of times I come from I say long-term care background, so that was one of the things I asked initially was, one time we say long-term care, we automatically think nursing facility, whether that be skilled assisted living, whatever the case may be. So a lot of what we're going to be talking about today is outside of facilities. So when we say long-term care planning, we're looking at aging in place, planning documents, activity, not being so isolated.
And to that point, you mentioned that a lot of the people taking care of their parents are also taking care of children of the sandwich generation. So that also creates a great need for assistance in that long-term care planning.
Thank you. We've touched on this already. We've been starting to talk about isolation a little bit, but I think to, again, in the interest of level setting, somebody talked to us a little bit about a phrase I often use, which is calling isolation a social determinant of health, particularly in older adults. And Rebecca Murphy, former Surgeon General, has talked about isolation as an issue, but would somebody be willing to sort of talk about where social isolation ties in with this notion of social determinants of health?
I can speak to isolation as an impact in fall prevention. I teach a lot of fall prevention classes in matter balance specifically. And one big determinant of falling is isolating. You stay at home, you don't get as much mobility, you don't get as much practice and movement, so that greatly increases your risk of falling in the home or falling in maybe the rare opportunities that you go out.
As a nurse, I can say that it also increases your incidence of developing dementia.
Yes. Thank you for that.
And that's part of what we're so let me take the conversation to another step. And Dara, I'm going to ask you, you're quiet, so I'm going to ask you to take this question first, although this really fits with everybody, which is, please talk with our group a little bit about how your program and your organizations fit the conversations that we're talking about, supporting older adults throughout Louisville as well as their families. So I'm going to ask Dara, you to start, but you've been politely quiet, and I don't like that.
Thank you. Okay. Okay. So I'm from the Trager family, JCC, across the street, and we have an older adult program that's very comprehensive. It's one of the few in the city that offers like a 4-tier program. We have 29 exercise classes a week, including recently, our most recent class was a better balance class 3 times a week. Then we have lunch Monday through Friday. It's a vegetarian or fish-only lunch sponsored by Kipton Louisville Metro. Thank you. And our food is made in-house. We have our own shop, and it's quite good and fresh. And then after lunch, most days we have programming. We have films, we have lectures, we bring in live music. We had a cooking class last week for the first time. We put out little plays. We do we sing along with lots and lots of activities. We have memoir writing, Spanish lessons, art lessons, like anything that someone can come up with that they have an interest in. If I can make it happen, I'm more than happy to do that. We also offer transportation for those living within a certain radius. It's usually about a 15-minute radius from here. And I have those zip codes. And then we offer Meals on Wheels for those who qualify. So a lot of places in town congregate lunch sites for exercise, but I think we're the only one that offers all three.
Does that have a cost associated?
So ideally, if you can we have a limited membership that's for seniors that's very cost effective. It's $120 a year, which is $10 a month. And with that membership, you can use the walking track, you can take those 20-minute classes, come to lunch, and come to activities. If someone truly can't afford it, we have scholarships available because we are grant-based programs. Yeah. I have all the information outside on a couple different flyers with my cards.
I'm going to ask Dara for some ideas for activities for the resident sites that I serve, and have had some actual significant increase in positive increase in both 11 and UCLA. Just to share that with you guys, I mentioned previously when I first surveyed my groups, the Lovin score was 39% for feeling socially isolated, and that score moved to 69% in the last year that I've been working with folks. And then we looked at the UCLA score was 45%, indicating moderate degree of loneliness or moderately high. That improved, 79% improved. So we're looking at some pretty significant improvements once we start providing activities. And, you know, work like Dara's definitely indicates that in the seniors and the codes around here.
We are also tracking new clients this year through the Flourish Scale due to a grant we received from the Legacy Foundation. So I should have more data in the next coming year about how people have felt since they started the program. But I don't think I've ever met anybody who hasn't felt an improvement since starting the program.
And are there other services that JFCS provides besides the social activities services?
The JCC.
Well, I was thinking, well, I know that we partner with JCC, right? We serve, right?
Yeah, we do quite a bit with the West End work as well. We also provide quite a bit for the rest of the city as well. That's our big focus, obviously. We have case management. We have, I teach like a matter of balance, and I've got 2 more case managers who are going to be trained in matter of balance, which can be offered anywhere in the city. We do so much work that is sponsored by KIPTA. And another newer program that we're developing, kind of speaking to that sandwich generation and the need for caregiving, is the geriatric care coordinator, which kind of functions as like a paid family member to kind of serve that role where, you know, someone like me may not be able to take care of my parents because they're in Owensboro, but I could seek out some help and getting their needs met and that long-term care plan, finding ways to meet their needs physically, you know, help them plan financially, or even serve as like a mediator in a lot of ways.
And then Justin, do you want to talk a little bit about how the Trager Institute provides the services that you're describing, like sort of in what context those things occur in?
Sure, so if you think about, I always come back to like the core of everything we do started with geriatric workforce enhancement. So starting with professionals and training students to assess people around health determinants, older adults who are trying to get in place. So this started, the core of what we did was training social work students primarily to assess older adults who are wanting to age in their homes around their healthcare determinants and then connecting them with community resources. So that's where we started, and now we have a primary care office that does that and also provides primary care and behavioral health care. And we're starting to develop a network out in the states where we're working with other area agencies on aging. They have this social work students embedded in community agencies, but also in long-term care in hospitals. So the idea is we're trying to develop a network of people who are assessing around health determinants and then connecting people with resources. So we do that through satellite sites and also through the primary care office in downtown.
So I think I'm gonna divert from the planned questions. This is, I think, a good time to pull in a question from the audience that was asked. I'm gonna speak from a CEO perspective after I ask the question, then I'll throw it to you. Which is, the question is, how will nonprofits continue to support those in need with the current setbacks in all things that are related to DEI and poverty? And actually, I'll share a quick story, which is that January 24th, there was an executive order that ceased all funding from the Federal Administration on Refugee Services. January 27th, there was an executive order that ceased all federal grants and programs, and loans, federal grants and loans, which then about a week later was, there was a lawsuit, it was rescinded. So in that interim week, JFCS had all our immigrant refugee services funding ceased for about a week. But one of the things that we did was we reached out to our funders. So for example, I've knocked on Martin's door with our senior director of programs, who's been working in this area for a long time. And I asked her to call KIPTA and asked KIPTA what, if we had to worry about our funding. She just said, we're good. And indeed, indeed, whether it's because the Older Adult Act is from a different pool, or exactly how all those things translate, I will share that story with you all. I don't, at least to date, I've heard no direct connection between older adult services and DEI or current funding cuts. Having said that, I'd like to hear from the panelists.
Yeah, I mean, I think, and I can't speak from a CEO standpoint on funding, but one of the things, and I may be jumping ahead with some of the questions that are coming, is anybody in here, I know some people, because I've looked at faces, that has heard of the Louisville initiative and the work? So that is a partnership between 4 agencies who were AARP, the City of Louisville, Trager, and HIPTA. And we're just started phase 2 of our age-friendly work this past year, 2024. The thing that is different, I would say the most from phase 1, as leadership we have discussed, is phase 1 we were very hindered by COVID, right? We had this great action plan with all this stuff, and then, oh, by the way, you can't get it together and actually do any of it. But in phase 2, what we're seeing more than anything is the cross collaboration of not just the domain work groups. So we have 3 primary domains this time, which is housing, outdoor spaces, outdoor enhancements, and social participation. And we kind of weave the communication into all of them. There's been a whole lot of cross collaboration, not just with the domain groups, but with those people who are attending. So we are having more partnerships, projects, applying for grants, applying for funding to get stuff done with a lot of the nonprofits that are out there doing great work, but are at risk of maybe some funding cuts. And really being able to kind of merge that together with some of the nonprofits, some of the places that are for-profit who have a little bit more money to spend. So it's been a really nice thing, but it's been very interesting and so different from what we experienced the first 4 years of our age-friendly work. So I think what you're going to see, just outside of age-friendly, but overall, is you are going to see more people kind of coming together and relying on each other a little bit to get the same great work done and take care of people. I think it really is, even though doors are closing in some regards, I think they're opening up a little bit and forcing people out of the silos to be able to have a lot more interaction. There's so many people who are blessed in the city in comparison to some of the work that's done in the rural counties, that we do have a lot of great people doing great things. We have a lot of options, but putting those people together and kind of breaking down some of the maybe competition that's been there in the past, to be able to work together more to achieve the things that we need to take care of our residents.
Yeah, I see that a lot too. I do participate in age-friendly Louisville social inclusion work group, and one thing that I've really seen is that it's about collaboration. We all have the same mission to serve the aging community in Louisville. So I know that if I have a problem that we may not necessarily be able to address in JFCS, that I have a list of folks that I can reach out to with this problem and ask, how can you help me solve this? And that collaboration has been such a help, such a forward for our work, as well as serving the community.
I want to just say that the club, all this stuff, a little plug for the Trager Family JCC. Our senior adult program is not a money-making program. We have lost money for 60 years on this program, but we feel that it's an important service to the community. So we make it happen no matter what. So it may not always look the same if we were to see huge cuts, but it's really important service that we provide.
As a 40-year, but now retired clinical specialist in the ICU, I am super concerned about all the cutbacks in all the medical research and all the new thoughts about vaccination, not really crazy. I'm very concerned because that's going to impact all the people that we try to help, because they're going to have more infirmities, more issues, more needs that are above and beyond their isolation, you know. I just don't know how we're going to make the impact that we want to make with all that's going on right now.
So I will agree with you. that gets us a little off on the side of what we're talking about today. The only thing that I will say is to some of what you're saying, Sarah, is that, like next Monday, I'm attending a meeting with other nonprofit leaders and several foundations in the community that these are all nonprofits that are working in a particular sector of our community to talk about the importance of collaboration, given that there is, Humana Foundation, for example, is in the room. Humana Foundation can take every single penny of its endowment and put it into older adult services tomorrow, and it will, if indeed cuts occur on the federal level, it will not be able to compensate for those cuts. And so what will become important, again, is the CEO talking, I guess, but it will be more and more important that agencies figure out how to cross-collaborate and how to work together instead of fighting over the limited resources that are left, because that's the only way that we can truly create this safety net programming that keeps people involved. So that's, we, at this point in this room, we don't have a lot of impact on executive decisions, right? At this moment on the federal level, what we can do is figure out how we can still provide the services. So, and that actually gets us into, I'm going to skip over a section which we'll come back to in a minute, but that gets us into a little bit of talking about what are some of the innovative programs that our panelists are already doing, that are thinking about that provide services, because how do we provide services in more innovative ways for our community. So if any of you would like to talk about some of your innovations that help older adults remain healthy and independent for longer, I think this would be a good one.
I think I mentioned both of the ones that I wanted to today, but I'll reiterate. The Humana Foundation's very generous grant to work in the West End. I shared my data. I want you all to know how big of an impact that is, how innovative it is to be able to bring programming to underserved sites. But one other thing that we have done to our regular, we offer a lot of case management, where we've kind of stepped that up quite a bit under, we call it our geriatric care coordinator, and that is, that's that professional family member. That's kind of that additional help to offer families and individuals services that they may not be able to get from kind of average case management. It's, that's that family member who will go to doctor's appointments with them, who will mediate with children living in other states or difficult relationships. It's providing that service that someone may not know how to navigate finding long-term care or planning for long-term care, having someone kind of really in love with them.
I can go next. As you all know, the city of Louisville, we are big. We have a lot of us. I think the most important, we can look at the different options. We have a lot of great programming. We have a lot of things that are same great work, brand new name, Office of Social Services provides, is really trying to put ourselves where our residents are. So we have this great space in Old Louisville, but not everybody can get to Old Louisville to come visit us. So, the neighborhood places, those are in each of the different neighborhoods. And all of them offer different things, sometimes rotating, but financial counseling, housing assistance, utility assistance, mammogram, buses, blood drive, whatever. There's all kinds of things that are constantly kind of rotating through there. And it really is a front door in the community to the work that's done in our office. So I would always encourage people to, A, utilize that. But B, also, and I have a whole bunch of stuff out there on the table too, from not just the Office of Social Services, but across the board. We do have, the senior nutrition, we have our congregate sites that are open, most of them every day, 9 to 1. They do activities and you can have lunch, and I say they all have a different feel, so it's kind of what you like to do. If you like to shoot pool, go down to Klein. If you like to play cards, go to neighborhood house. They all do a little something different. But also not forgetting about the programming that is free through our Parks and Rec centers, through the community centers, through the libraries. I looked it up today just for reference because the libraries amaze me. They have a great website. If you are tech savvy, you can go and filter what kind of programs you want, where you want to go, what day you want to do it. But just for today, for March 18th, for adults and older adults, there were 14 different programs, which is really just kind of a cool thing. And so I kind of looked at it to see where they saw the same thing. And there was a crafting circle, there was AARP doing free tax preparation for individuals, 4 different book discussions, including an early bird and a late night. A Spanish class for beginners, opportunities for civic engagement, so conversations with our local metro government city planners on what they've got going on in the community. A trivia class, or a trivia game, I guess. Art classes, and then a mind and body wellness series. So you really see things breaking away from, a few years ago, it was like, oh, let's do puzzles, and let's play bingo, and let's do some stretches, and, it really is, there's something, if you don't like one of those, and they have different things all the time. So really looking at what opportunities, when we talk about isolation, we know one of the biggest barriers to people being engaged is transportation and access. But all of our libraries are on bus routes, they're, open to the public, for free, no one utilizes those things. We have our AmeriCorps programs, which I'm over, so our retired senior volunteer program, and our foster grandparent program, that information's out there as well. And lots of volunteerism. If you were a person who likes to volunteer, we got all kinds of things for you to do. But I would just say, looking at the options, they really are out there. It's just how be encouraged to really find some of them, or to bring them to individuals where they are, and how do we do that? That's what we're going to do.
So actually that, where you ended is kind of where I was hoping to go next, which are, and I don't have a group of questions, but where are the gaps? So it sounds like you've anticipated, or you see one of the gaps in services is not who served, but it's connecting to, finding those folks and connecting to those folks.
Transportation, always a barrier. And I've got, just so you all know, my aging services coordinator and my disability and access coordinator here, Greg. We take calls all day, every day from individuals in the community looking for resources. Housing and transportation are the 2 biggest across both sectors. So we know that that's an issue, right? The other one is going to be things that are funded based, especially there's age parameters on that. There's a huge gap for those adults under the age of 60. So when we look at congregate meals or Meals on Wheels, you have to be 60 years of age and older. We have a lot of individuals in our community, we know, if you look at the West End, the average age is 67. We have a lot of people who are in their 40s or 50s who really may need some of those services but don't have them. And I don't know if you know that the cost of meal delivery is not cheap outside of that. So there are gaps as it comes to funding and age. Things like the library, those kind of things, that's open to everybody, so those are great, but the access and the funding, those are the 2 biggest ones, or at least in our line of work.
And are there particular regions of our community or populations within our community? So under the age of 60 is one population, one demographic, right? But are there other regions within our community that we're not, the sectors of serving, that we're not somehow not connecting to them, that providing the supports for the sectors?
I was gonna say, I hear transportation all the time in my work in the West End, but even a lot of our clients, we do hear that transportation is an issue. In the West End, it's difficult for older adults to use the bus to get car-free or get to doctor's appointments. So we do hear a lot that that is a struggle. And with in a low-income housing, which is typically where I work, they don't have a lot of wiggle room for paying for rides or doing paid programming. It's a big challenge.
And what about technology? You talked about sort of being tech savvy, being able to access these classes. We, as an agency, and all of our agencies have had to do this post-COVID, is that we pivoted to telehealth and we've stayed in that, we all have platforms that we now use.
Anybody want to speak to whether that's what are the positives, what are the cons for that, for our population?
So there's definitely a divide, I think, when you look at older adults 60 and over, that 60 to 72-ish, much more tech savvy, right? So their QR codes, they've all got emails, and they're seeing a lot more opportunity in the technological stance, especially as you continue to age. I oversee our foster grandparent program, and the average age of our foster grandparents are about 80. I have currently 76 foster grandparents in the school system. 2 of them have emails. So we have to communicate with them very differently. So, there is a little bit of, we only rely on virtual platforms and technology and registering for things online and using QR codes. That kind of skips or misses or doesn't, get the information to some of the individuals we may need it to. But I think moving forward, it's going to be much more accepted and used a little bit more. But yeah, you'll definitely miss it. You'll miss my foster grandparents if you only use that.
Now, there's definitely that education gap, but I have found that in a lot of situations, if you bring someone in to help and answer questions, the older adults that I work with are really happy kind of bringing you their phone, teaching me how to use this, teaching me how to fix this. I've actually used someone from the RSVP program to come to one of my sites regularly, and he sits down in the basement for an hour or so, helping people figure out how to use their iPads or their laptops every other week, and it has been, I think, one of their most appreciated services.
You look like you want to say something.
What I was gonna kind of dovetail on what you were just talking about is finding almost intergenerational ways to use technology with social inclusion aspects here. There's just the technology piece of having a Wi-Fi independent device. So those are kind of like the initial barriers, but then actually using them. That's something that we talk about in the social inclusion conversations with Patient of Louisville, is like, how do you create something for everyone, but also we heard from somebody that they developed a program that was around teaching older adults how to use technology, and they didn't want to start and do the curriculum. They wanted to find out very specific things, like how do I send a picture through text to my grandkids. So like finding where their interest is and then teaching to build from there is something that I hear that a lot. I hear you have to be kind of innovative to provide interactions because people want to learn specific things.
And then you're creating, I like that paradigm, right? Because you're creating a social interaction through technology as opposed to we think about technology as being isolated. Right?
And we heard this from one of our the age tournament coordinators. She talked about her grandchildren teaching her how to do things with their phones. And so it's serving a couple different purposes. They're learning a useful skill, but then there's some kind of reciprocity between the generations. Okay.
I also, as we were talking about this, and some of this goes back to also the questions about federal funding related to poverty and DEI. I'll just share briefly. I'm aware of 2 strong advocacy efforts on the federal level. One is related to a bill that it sounds like it has pretty good bipartisan support, which is the Social Security Income Ceiling Elimination Act, which moves to change the limits on how much an individual is allowed to have in their account, in their savings account, if they receive SSI benefits. The limits right now are $2,000 for an individual and $3,000 for a married couple. If you have more than that, then you start to lose your SSI benefits. That has not changed in 30 years. I think that number is 30 years old. So they're talking about increasing that limit and indexing that to inflation. And then there's a lot of advocacy going on as we speak about Medicare's benefits related to telehealth services and trying to extend the deadline on the use of telehealth as a reimbursement to Medicare.
Yeah, I'm a nurse case manager for First America. We're a home care agency over in Indiana. And my question is, do you see the Kentucky being a certificate of need state being a problem in the future? A lot of the home visits I do, transportation is a huge one, getting people to their medical appointments, so we kind of bridge that gap. But as the aging population grows, do you foresee this being a continual problem? Is anyone looking at removing that to allow new agencies to come in and kind of?
Does anybody feel comfortable explaining the notion of what a certificate of need state is?
They're not profit, so they probably wouldn't be doing a certificate. They're non-profit, so they don't have a background. So that would be.
But, I mean,
It doesn't allow new medical agencies to come in and provide medical services to Kentucky.
I'm versed in certificate of need because, like I said, I worked in long-term care for a very long time. Do I think it could, pose a problem? I think there's a few things that, when we look at Louisville and its decreasing population by, 0.5% every year. I think that goes into it, and I only say that when I talk about our older adults because our bordering states, and so this is something I have the power to change certain things, but at the city level I don't. It's a state issue or federal issue, but there are some, you look at our bordering states that allow Medicare, Medicaid reimbursements for different levels of long-term care that Kentucky does not. So if someone truly needs assisted, they don't need needs for qualifications for special care, they can't afford in-home care, they can't afford private pay, a lot of times we see them go to Indiana or some of our other states so they can have the higher levels of care be reimbursed by insurance. In terms of, I know more on certificate of need as it relates to palliative care, hospice care. But I think, our options are great here. But I think, in terms of if other people can offer and their businesses allow transportation and some of those gaps, then yeah, I think we are missing out at that point. If we can't figure it out, and how to do that and grow those companies to be able to do that, a lot of it comes back to funding. And so that's where, I think a lot of the gaps are going to continue to be is, yeah, I think a lot of people would love to have transportation programs, but how do we afford it? How do we have the insurance? How do we have the workforce? We know that there's a workforce shortage across the board of facilities, restaurants, wherever. How do we meet all of those needs? And I think a lot of it, unfortunately, comes down to what are we getting for the funding to be able to pay for it.
And I wish there was some sort of laws that could help with the liability, because I'm trying to organize a volunteer situation at the JCC for people who need, I was getting a ton of calls, I need help getting to chemo, I need help getting to surgery, people needed help and they didn't have anyone. But we talked about it and the liability, people don't want to take on personal liability, or the organization doesn't want to take on the liability. So I wish maybe there was something that could help in that situation.
Some kind of good Samaritan law or something.
Something like that.
You have organizations like Centerwell or Gen Care that can provide transportation to their patients, but that's such a small number of the hospitals and doctors in the city.
Justin, what do they do in the village systems for people that are transporting neighbors and such?
So, for context, what Deb is talking about is there's a national movement called the Village Model. And it's a membership model that is almost always subsidized. And it pairs people in the community who are older adults who want to be part of this village with volunteers. And the volunteers do a lot of different things. Social inclusion and visitation is one, but transportation seems to be across the board something that volunteers to almost every village I've learned about. And how they handle that, they handle it, I mean, I think sort of to your point, I think it is something that they all handle individually, but there are something around our insurance policies of how they develop it so they can have volunteers who provide services. And I'm not a lawyer, so I don't feel free, but if you want to learn more about the village model and maybe connecting with people that are doing this in other communities,
That'd be great.
I mean, that's to come up with something. It could just be that we're all in this together, so we all agree that we're not gonna, that's kind of on a whim,
So there's a couple of questions I haven't asked yet related to barrier issues that I want to touch base on. And one, maybe out of all of our expertise, but it was submitted online, so I want to honor it. Which is that in your work, what size rental of home or unit and or bedrooms is most needed by seniors in Louisville that's not being built by local home builders and is affordable housing developers? So it's a
I don't know about size, if you're talking square footage, I don't know about that. Obviously a lot of the calls we get are for single family households, so single people, and accessible. So the ground level has accessibility features. Those are in, what was that big number? There were 42,398 individuals over the age of 60. That's a lot of accessible housing. That's the number of disabilities. That's a lot of accessible housing. Yes, there are set standards as to, don't ask me the ratio because I will not be able to quote you that. Greg may know better than I. When new developments come in, there has to be a certain limit or a certain number of accessible spaces, whether that's elevator, they don't have to be on the first floor, they can be elevator based or whatever, but I definitely think the hardest thing is some of the use around established buildings versus new buildings and not having to change some of the, just if you're using it as the same thing, and I don't know if you will know that, like, so if I don't know, our barber shop is not accessible in downtown Louisville. It's got 3 steps to get into it, the doors aren't wide enough, etc. Business sells. Somebody else comes in. As long as they make it a barber shop, they don't have to make it accessible. They don't have to bring it up to ADA standards if they're already inside. If they turn the barber shop into an ice cream shop, then they have to. So, I think some of that has to change a little. I think everything needs to be a little bit more accessible. But that's, I would say, the number one thing, besides just an overall shortage of housing, that is a big part of what our Office of Social Services does. We have our Homeless Services Division and our long-term housing. We know that the numbers are not there. The mayor's working very hard to increase those numbers, but they're just not there. And then also making sure that when things are being built, where they're built is very important. So are they being built in places that are on bus routes or close to grocery stores, pharmacies, those kind of things that are very important, or is somebody having to rely on Good Samaritans or other poor fee-based things to get them to essential vital services? So that's where they're being built. It's also something that's really to pay attention to.
And I'll just, since there's a new coalition of which JFCS is a member, led by Metro County Way, the Coalition for the Homeless, called Safe and Stable Housing Coalition, I think is what we're called. That actually is attempting to work with Metro government to increase some of the funding for affordable housing across the age spectrum, and also so this works on increasing the bonding available to build affordable housing, but also is working to increase some of the funding for prevention services, so emergency rent assistance and things of that nature. That's a movement that we'll be hearing more about.
And for aging in place.
And for aging in place, yes. So it's really across. So it's an attempt
to think about housing needs across the age continuum, not just, that's really. The last question before I turn it over and see if there's any other questions, and this has been a great interaction, but sometimes the panelists talk and then later the audience asks questions, it's back and forth, which is much better. We had one other question that we said we were going to get to, we've not touched on yet, and I think, Justin, I'm going to ask you to start with this, actually, which is there difficulty in helping older adults find employment in what somebody referred to as the age of ageism? I mean, is that an ongoing issue?
So, I mean, the short answer definitely is, I think, yes. Everything I know about this has been anecdotal. Watching my father do this after he retired, looking for, ways to stay engaged, and then I've heard this from other older adults that I know that they retire from a position, unless they're jumping right into something else, or have an entryway into something else, they often struggle to find, meaningful engagement after they leave their primary job. So everything I know is anecdotal in this area.
I was gonna say, we hear a lot about volunteer programs for older adults, but as far as career services, we do have career services and we do have career services specifically for older adults to kind of find that opportunity to get work and support through making the challenges of ageism and skills.
I would just say that what we're seeing is a lot of people returning to the workforce at an older age. They retired, and because of the increased cost of living, increased, a lot of landlord rental prices have been fixed or at a certain amount, now have gone up. A lot of people are having to return back to the workforce. One of the things, there are a few agencies across the city that do assist specifically seniors and finding employment, but also making sure that, those individuals who are disabled are able to, the needs are being able to be met. So, we do have coalitions for workforce diversity. We have a lot of, Greg can tell people, he will help you. He came from voc rehab and that was his specialty, but making sure that we're working with employers to educate them. The ageism piece I think is real, and that's not just for individuals 60 and over. A very dear friend who's 45 and laid off and has not been able to find a job because he's been in a field that typically is meant for, new hires or younger, and so she's having trouble with that. So being able to help employers be educated on different technologies, different services, different ways that individuals can be supported, especially if they do have any sort of disability in terms of equipment or cognitive, needs or changes. I think to let them know, what's available is very important, so they don't feel that they have to maybe do something that is outside of their scope that they haven't been comfortable with. Sometimes they just need the education to be able to have a more successful workforce.
If there's anyone here who's interested in an ending ages together workshop, the Trager Family JCC is hosting.
Can you say that one more time?
Ending ageism together. Ending ageism. Anybody here who works for an organization who's interested in that, we're getting ready to host a workshop on the 25th. So see me, give me your email, and then you can share. Tuesday, yeah, it's Tuesday.
Thank you all very much. Any before we thank our panelists here, any other questions in the audience that we didn't get to?
Hi, I'm Avram Khan. I am the Executive Director of Cole Israel. We're a emerging spiritual community, and I've had discussions with you, David, and I've had discussions with you, Justin. We're trying to find a niche that is not being taken care of, and David suggested on the spiritual side to bring that isolation and the people together that are isolated and feel out, and also including intergeneration, trying to a work in progress. What is the best way, instead of talking to everybody individually. Is there a point person that would make the most sense instead of trying to do things separately with everybody, trying to find one point person to shepherd a product that we're putting together? I guess that makes sense, right, David? What's the best way to do that? And the other question is, do you work with churches? Are churches part of this, or do they have their own separate programs and they take care of their own within their flock?
Yes and no. A lot of, we have the community ministries, which we haven't talked a whole lot about today. And we have a lot of veterans programs who work very much with a lot of faith-based alliances. We haven't talked about veterans in a lot of stuff, we can just keep going. But, so a lot of the churches where they do work in, I think, all of our spaces, but they also have so there's a lot of, faith-based communities and churches that they offer, they have a big senior group and they stay kind of within their own, or they have volunteer opportunities. And when I say that, somebody needs, they're homebound and they need someone to go shop for groceries. They have volunteers that will go shop for them, but you have to be a member of that church. They won't go do that for somebody else in another congregation. So as far as a one person or one agency to get information, and I just want to make sure I'm understanding, to get information to, or?
To have, and the question is, we're trying to find a home for a spirituality where we find, and Cole Israel we find commonality. We do things with all the interfaith activities, Center for Interfaith Relations. How can we find, is that something that would be welcome? Is that too religious type of thing, even though we try to keep things even, we're not pushing a religion, more of a spirituality to bring people together. Is that something that is too far one way or another, that kind of mixing religion and civics, so to speak? Does that make sense?
Yeah.
I mean, is something like that would be
I don't
welcome?
think it's too far outside of the scope, when you ask that. I don't think it's too far outside of the scope. One of the things that we're blessed with in mobile is I feel like it is a pretty wide array of religions and races and cultures, and, we do a lot to celebrate those, to be inclusive a lot of times. I'm having trouble thinking of
So,
kind of that clearinghouse.
so Charles Booker is the director of Kentucky's Office of Faith-Based Initiative and Community Involvement. So I know that, at one point Charles was really involved with doing things statewide, but also there were things that were evolving in Jefferson County. The initiative that I'm most familiar with was Greater has the Peace, and that's kind of fallen by the wayside. So I think that there are opportunities for community involvement with faith-based initiatives, but it's really congregational based and relationship based, and not something that's really well done.
So the answer, sounds like the answer is maybe.
Yes.
So
We're not set in any one way. We're looking for,
I think what you would find is a lot of different people, I know HIPTA has a newsletter that goes out. Mobile Metro Office for Aging and Disabled Citizens has a newsletter that goes out. You all, I think a lot of people would be very open to putting information in there and sharing it. I just don't know that there's one place that everyone would say, yep, that's the number one place to go to.
we'll take whoever will take it. We'll go wherever whoever will take it.
Send it to all of us, we'll try to
I don't want to be sensitive to the time, because we said 1 o'clock to people. I know people, especially in the middle of the day, people have places to be. I want to thank you all for being here. Join me, please, and thank you, You're passing by tables, which you probably saw on the way in, with a lot of important information for resources. relevant to today's topic, please put the program outdoor. And again, thank you very much for joining us. And hopefully we'll see you at our next community chat, which is the next time we have a community chat.
Order.